Namaste to all the distinguished clinicians, illustrious teachers, path-breaking work which is being done, everyone on the dais. It's an honor to share the dais with all of you. For all the wonderful doctors and supporting staff in the audience, thank you for being part of this amazing conference. And I must mention Indra and her team because they've done everything with a smile on their face. And I will claim to be only the support system. Thank you all for being here, and it definitely is a privilege. And I understand it's the 26th National Pediatric Intensive Care Conference. That's quite a milestone. It has grown. I understand there are 800 people who have registered. But each one of you in the regions where you belong to have made an impact. It was kind of nice hearing that, you were all associated either as students or parents admitted in Apollo. It goes to show how old we are, I guess. So it's nice to be a slight elder and hopefully mature. But having said that, I think it's a responsibility of an organization who's been around for 41 years to do what we have to do. And most organizations come into being because there's a crying need in society to do something which is important, which is impactful, and which will make a difference in people's lives. And that is why my father, Dr. Reddy, when he came back from the US, said that we need to start a hospital which will bring the highest standards of medical care to people of our country and will invest in research, in education for the betterment of mankind. And India today stands tall in the global healthcare field, that it's not only a healthcare system like Apollo, but Dr. Ilan is here from Dr. Rela's Institute, and we follow and admire what they do. And many of you belong to different institutions. So what has happened is that the standard of healthcare in our country has gone up, and we have been able to, as a group, as a team, throughout the country, each one of you clinicians have raised the bar. And I think that is really why we respect our clinicians, we respect the supporting staff, and I love the way you brought the nurses into it, because we are realizing that if not for the strength of the nurses and the support staff, no institution can be the way it is, and especially in the area of critical care medicine. So I think it's phenomenal that they have been included, and I think they will make a huge difference in what we do. The Apollo's journey in pediatric, hospital or just special unit, special focus, the credit has to go to Suchitra. She's demurely sitting there, and Indra and Dr. Meena. I think this trio of amazing, bright women walked into my office and they made this presentation and said that however small, we need an identity, and we need to be able to focus and do what we're doing, for pediatrics. And that's how it started. We, just picked up a building which was not that great, not that optimal, and did our first pediatric hospital. But what it has done is that it's raised the bar on how, pediatric healthcare is delivered, whether it is transplants, cardiac care, cancer care. But what it has also done is that the pediatric intensive care has, we've managed to raise the bar. And if we are part of this amazing conference, which is focusing on pediatric critical care, I think the journey has been amazing. And I have to thank each one of you clinicians on the dais, off the dais, for really contributing to make this a better place for pediatricians. For children who come to us. But the responsibility of leadership does not just stop with what we do on a daily basis. We have to think beyond our boundaries. We have to think, how can we take this level of critical care, high-end care to each one of the children who come to us. And that's why when doctor made a comment on how expensive it was, I think, quality, there is a cost to quality. There is a cost to be paid for infrastructure, for salaries, so on and so forth. But having said that, today we have answers. Today we're able to do things which we do. We had the courage to set up a proton beam therapy center. A lot of patients who are being treated there are children, they're peds. And we find ways and means to, for those who can't afford, the foundation pays for it. People contribute. It's being done. There is crowdfunding for children, and that's doing extremely well within our network and outside our network. So that's a good thing. But what I think is really path-breaking, which has happened in our country, is insurance. Insurance has come in multiple formats. In the state, and we were the first ones who helped the state of Tamil Nadu do it, there was a chief minister scheme. We did a 1 rupee a day insurance scheme in my dad's village. Now, every state has an insurance scheme which is funded by the state in some format or the other. And today the government of India has also got a scheme for people, and we should not be afraid of it, because Ayushman Bharat, most institutions do some amount of that work, while the standard in the government institutions has gone up tremendously, that we don't really have to worry about quality and standard of care and so on and so forth. So I think that has been path breaking, that we have been able to make healthcare accessible to a lot many more people than they were even 15-20 years ago. So I think that has made a huge difference. The second difference has been in the use of technology. And that, I think, is something we should all adopt and look at. During COVID, it just grew in leaps and bounds, and that's telemedicine. We started it a long time ago, and every institution now has adopted it, that if you can reach out to the undeserved, if you can reach out to locations which are geographically very difficult for people, then we've overcome the burden of geographical access, which is a huge point. So if we overcome the burden of financial access and geographical access, we have actually done a lot. We've come to a large extent to do what we have to do. The third area is, of course, that we all have to commit to outcomes and quality. It's not enough that there are pockets of excellence and islands of excellence. The network has to be excellent. Outcomes have to be measured, outcomes have to be monitored, and outcomes have to be there. And no institution should be selfish about their clinical protocols. That is why this conference is amazing, that if you can all just share outcome data, clinical protocols, training, exchange of ideas, it would be really meaningful. And I'm sure that all of you are deliberating that more than anything else. We have to be multidisciplinary. Gone are the days where, just one discipline was enough. I think everybody knows that, if it's critical care, multidisciplinary, they have to come together. You might need cardiac, you might need a transplant specialist, you might need a nephrologist, you might need everyone to come together. And that is happening in a lot of institutions. So more of that would be extremely useful. And before I close, I just want to tell all of you that, there's so much of talk of AI, and no conference is complete unless there's a thought, a discussion on the future of technology, on the future of AI. Many of us look at it a bit gingerly and wonder if it's going to, overtake what we do. I think we will have to use it as a co-pilot. We will have to use AI to navigate, but the point of high tech will never take over high touch. And all of you sitting in this audience are the ones who have the steering wheel. You hold it in your hands, and you are the proponents of high touch. So if anybody is talking about AI taking over what the clinicians do, of what the healthcare people do, I don't think it will happen. We will just be quicker, better, faster, more focused, and our outcomes will serve not only patients, children in our country, but the rest of mankind for the future. So thank you all for the invitation. God bless, and Jai Hind.